I'm Dr. Marcus Bennett, and what I'm going to walk you through today is something I've observed over many years in clinical practice, and that the science is now confirming with increasing weight. Consider this for a moment. You take a tablet tonight to help you sleep, something tens of millions of Americans do without a second thought. What many still don't realize is that that same medication could be quietly, progressively erasing the memories of tomorrow. And I'm not talking about a theoretical or distant risk. Medicine has been observing this pattern for years, and the most recent data is confirming it in ways that are difficult to ignore. A study published in 2024 in JAMA Neurology, one of the most respected medical journals in the world, reinforced something those of us in clinical practice had already been noticing. There is a well-documented, dangerous connection between the continuous use of certain medications and brain atrophy. That's the physical shrinkage of brain tissue, and this process can increase the risk of developing dementia by as much as 50%. This one's worth your full attention. In this video, I'm going to walk you through the 5 groups of medications associated with brain inflammation and cognitive decline. But more importantly, I'm going to share what I call the hidden marker that researchers use to measure this risk, the Anticholinergic Burden Scale, and how you can use this information to protect yourself and the people you care about from a disease that affects millions of Americans every year. I'll tell you now, the #1 medication on this list is going to catch you off guard. It's something millions of people pick up at any drugstore, considering it completely harmless. Yet it carries the maximum risk score for your brain. That's what I'm here to show you. But before we get into it, if this is already useful to you, go ahead and like this video and subscribe to the channel so you don't miss content that could genuinely protect your health. Turn on notifications so you don't miss a thing. And here's what matters most. Share this. Think about your parents, your grandparents, your aunts and uncles. Who among the people you love is taking multiple medications regularly? Sharing this video in a family group chat is a real act of care. Do it now. And tell me in the comments, do you or someone close to you use sleep aids, allergy medication, or anti-anxiety drugs regularly? I read every comment. Let's get into it. First, you need to understand what an anticholinergic medication is, and why that term is so directly relevant to your memory and your ability to think clearly. Think of your brain as needing specific building blocks to construct memory, concentration, and clear thinking. That foundational building block is called acetylcholine. It's an essential neurotransmitter. Without acetylcholine functioning properly, memory cannot form. To produce it, your body needs to manufacture it from the choline you take in through your diet. Where do we find choline? In foods like eggs, especially the yolk, liver, meats, fish, soy, and vegetables like broccoli and cauliflower. Now, an anticholinergic medication does exactly what the name suggests. It blocks the action of acetylcholine. It dismantles it. That foundational building block turns to dust. The result? The name of the person you met yesterday, the task you needed to focus on, where you put your keys. All of it gets lost in that mental fog that so many people experience, but rarely trace back to the medications they're taking. That's why sometimes a word feels like it's right on the tip of your tongue, but won't come. Your most important thoughts are being misplaced constantly, and this isn't just a feeling. It's a real, measurable chemical effect. You may now be wondering, how does this blockade, this anticholinergic effect, actually lead to brain shrinkage? That's a question neuroscience is now answering with increasingly precise neuroimaging studies. The truth is sobering, and it's worth knowing. Chronic acetylcholine blockade doesn't just impair communication between neurons. Recent studies show that sustained blockade increases brain inflammation, and this is the most concerning finding, can accelerate the accumulation of beta-amyloid plaques, the exact plaques that characterize Alzheimer's disease. There's more. An article published in JAMA in 2025 found an even stronger association between these medications and vascular dementia. This suggests the mechanism of damage is twofold. In addition to sabotaging neuronal communication, these drugs appear to be contributing to inflammatory and vascular changes in the brain, compromising blood flow and damaging the small cerebral vessels. The brain not only loses its ability to communicate with itself, it also loses adequate circulation. To quantify this damage, researchers developed the Anticholinergic Burden Scale, known as the ACB. It runs from 1 to 3. The higher the score, the greater the threat to your brain. This is clinical observation accumulated over decades, not theory. Now, before I give you the full list of medications, I want to make this personal. I don't want this information to sit in your mind as just another data point. Here's what I'd like you to do. Perform a medicine cabinet audit with me right now. I mean it. Pause the video if you need to. Go to wherever you keep your medications, that cabinet, that drawer, that box on the shelf. I'll wait. Got it? Good. From this point forward, for each medication I mention, check your bottles and packaging. See if you've got a hidden risk sitting right there in your own home. Agreed? One professional tip before we start. Ignore the large name on the front of the box. That's the brand name. That's marketing. What you actually need to find is the active ingredient, or drug facts panel. It's usually in smaller print on the side or back of the packaging. If you find any of the ones I'm about to mention, note the score. This is going to be eye-opening. Let's go through the list. Starting with number 5, fifth medication that increases dementia risk, bladder control medications. Many of the drugs prescribed for urinary incontinence are potent anticholinergics. Their mechanism works by relaxing the bladder muscle. But to achieve that effect, they block acetylcholine throughout the entire body, including, of course, the brain. Millions of Americans use medications like oxybutynin, sold under brand names like Ditropan, to manage overactive bladder. They're effective, no question. But the price is significant. These drugs carry a score of 3, the maximum on the cerebral risk scale. This is a pattern I see regularly in practice. Older patients who improve their urinary symptoms, but who within a few months begin showing confusion, forgetfulness, and difficulty concentrating. The family doesn't connect the two things, but the pattern is well recognized at this point. Before accepting this type of medication, it's worth having a conversation with your doctor about safer alternatives. Mirabegron, sold as Mirbatric, carries a score of 0 on the anticholinergic scale. Non-pharmacological options, pelvic floor, physical therapy, and Kegel exercises have also shown meaningful results in many cases. But there's no point protecting your brain from the bladder medication if you're continuing to use, perhaps every week, a drug for a far more common problem. Which brings us to number 4. Fourth medication that increases dementia risk. Antispasmodics for IBS and abdominal cramping. You may recognize some of the medications prescribed for abdominal cramps and irritable bowel syndrome. Many of them work as antispasmodics, relaxing intestinal muscle through anticholinergic blockade. One of the most common in the U.S. is dicyclomine, sold as Bentil. Its active mechanism relaxes smooth muscle, but it also relaxes communication in your brain. This medication carries a score of 1. That may not sound like much, but chronic use is like a slow, steady drip of risk. Day after day, week after week, the damage accumulates quietly. For irritable bowel syndrome, There are alternatives worth exploring with your physician. Peppermint oil, quality probiotics, dietary modifications, and, importantly, stress management. The gut and brain are more tightly connected than most people realize, and the solution often lies in addressing the underlying cause, not just masking the symptom. If you were surprised that a simple cramp medication already triggers a warning, the next point is where the conversation gets more serious, because it involves drugs that millions of Americans use for mental health, and some of them carry the maximum risk score. Third, medication that increases dementia risk, certain antidepressants, and anti-anxiety medications. The older antidepressants, particularly the tricyclic class, have a very strong anticholinergic action. We're talking about medications like amitriptyline and clomipramine. There's also hydroxyzine, sold as Vistaril or Atarax, which is used for both allergies and anxiety. All of these are strongly anticholinergic and carry a pronounced sedative effect. Each of them carries a score of 3 on the risk scale, the maximum. Now, and I say this to every patient I see, never stop a psychiatric medication on your own. Ever. The consequences can be serious. Any change must be supervised by your physician. The good news is that modern alternatives exist with far safer profiles. Antidepressants like sertraline, escitalopram, and vortioxetine carry a score of 0 on the anticholinergic scale. For anxiety and insomnia, trazodone carries minimal to no anticholinergic effect. These are medications that have been used for years, with solid results and a much better brain safety profile. Have the conversation with your doctor. The transition may be more straightforward than you'd expect. We've covered bladder, gut, and mental health. But what about that persistent back pain? The muscle relaxer you're taking may be doing the exact opposite of what you want, in your brain. Second, medication that increases dementia risk, muscle relaxants. Cyclobenzaprine, sold under brand names like Flexeril, is one of the most commonly prescribed muscle relaxants in the United States. The drowsiness it produces is a clear signal of its action on the brain. And it's not a mild one. It carries a score of 3, the highest on the risk scale. Taking it once or twice for an acute injury isn't a major concern, but chronic use for persistent pain is where the real threat to memory and cognitive function lies. The foundation of chronic pain management should be physical therapy, progressive strengthening, and safer analgesics. The goal is to treat the source of the pain, not simply mask it with a sedative that's also quietly eroding your brain. If that concerned you, prepare yourself. We've reached number 1, the one I promised you at the start. And it's the most dangerous for one very specific reason. Everyone assumes it's completely safe. Number 1. The medication that's most dangerous precisely because no one considers it a risk. Why does it top the list? Not because it's the most potent anticholinergic in isolation, but because it's the most common, the most accessible, and the most underestimated. It's sitting in nearly every medicine cabinet in America right now. I'm talking about diphenhydramine, the active ingredient in most over-the-counter sleep aids like Zizquil and Unisum, and dimenhydrinate, which you know as Dramamine. Yes, Dramamine. That medication millions of Americans toss in a bag before a road trip or a flight. Both are extremely powerful anticholinergics, carrying the maximum score of 3, and they cross the blood-brain barrier, the brain's natural protective shield, with remarkable ease. That's exactly why they make you drowsy so quickly and so reliably. Taking a Dramamine for a long drive, for nausea, for vertigo, for a bout of labyrinthitis, that's fine. That's a one-time situational use. But taking just half a tablet every night to help yourself fall asleep, that's an entirely different matter. You are, quite literally, giving your brain a nightly dose of one of the most well-documented risk factors for dementia that medicine currently recognizes. This is not an exaggeration. It's clinical observation, confirmed by years of consistent research. What are the safer alternatives? For allergies, use the modern antihistamines: loratadine, fexofenadine, cetirizine. All of them carry a score of 0 on the anticholinergic scale. For insomnia, the answer isn't a stronger medication. It's identifying the cause. Why aren't you sleeping well? Melatonin, magnesium, proper sleep hygiene. These are powerful, well-supported tools that don't compromise your brain. Don't use a sledgehammer to crack a nut, especially when that sledgehammer is aimed directly at your own cognition. Now, as we've seen through this medicine cabinet audit, the risks are hidden in places most people would never think to look. But the goal here isn't to create alarm. It's to build awareness, to give you the knowledge to make genuinely informed decisions. And here's the point that very few people fully understand: the one that can completely shift your perception of risk. Did you find an antispasmodic scoring 1? And perhaps a muscle relaxer scoring 3? And maybe an antihistamine you've been using to fall asleep? Your risk is not 1, it's not 3, it's not 2. Your risk adds up. In that scenario, your total daily anticholinergic burden is 6. 6 cumulative risk points every single day you take that combination. The evidence is consistent on this. A total score of 3 or higher, sustained over a prolonged period, is strongly associated with progressive brain damage and a significantly elevated risk of dementia. It's like taking small doses of a harmful substance every day. One isolated dose may produce no perceptible effect, but the cumulative total, drawn from multiple sources, building over months and years, multiplies in ways that compound exponentially. That's exactly why a complete medicine cabinet audit matters so much. Reviewing one medication isn't enough. You need the full picture. And if, even with all of this, you're still not entirely convinced of the stakes, this same pattern has played out more times than I can count in clinical practice. Think about your Uncle Robert, a 78-year-old man, active, sociable, always the life of family gatherings. But lately, everyone's noticed he seems more forgetful. It started small, where he left his car keys, the name of that actor everyone knows, what he had for lunch. The family jokes about it. It's just age, they say. That's normal at his age. But what nobody knows is that Uncle Robert has struggled with insomnia for years. And every night, for as long as anyone can remember, he takes just one little tablet to help him wind down. An over-the-counter antihistamine he picks up at any drugstore, no prescription needed. No one ever connected the two things. No one imagined that the pill helping him sleep could be, night after night, quietly wearing away his ability to remember even the simplest conversations from the day before. Uncle Robert's story isn't fiction. It's playing out in thousands of American households right now. Silently, invisibly. And here's the data point that carries the most weight. Researchers estimate that approximately 10% of all dementia diagnoses can be directly attributed to the prolonged use of anticholinergic medications. Read that again, 10%. That's comparable to other well-recognized risk factors: uncontrolled hypertension, type 2 diabetes. It means 1 in every 10 cases of dementia could potentially be prevented if people had access to this information and made more conscious decisions about their medications. That's why I'll ask you again, if you haven't already, please share this video. This knowledge can genuinely change the trajectory of someone's life, someone you love. And that awareness brings us to one of the most practical principles in preventive medicine, something I call the intelligent substitution principle. This is not about going without treatment. It's not about suffering unnecessarily or about panicking and discontinuing everything. Absolutely not. It's about making an intelligent update to your treatment, replacing a solution that extracts a hidden and very high price from your brain with an alternative that addresses your condition just as effectively without compromising your cognitive function over the long term. That's the approach I apply in practice. Always seek the safest available option without sacrificing the effectiveness of the treatment. So, at your next medical appointment, I'd encourage you to ask your doctor these questions. What is my total anticholinergic risk score, considering all the medications I'm currently taking? Can we apply the intelligent substitution principle to my treatment to protect my long-term brain health? Are there lower anticholinergic alternatives for the medications I'm on? These questions signal that you're an informed, engaged patient. And in my experience, most physicians genuinely appreciate that kind of conversation. Now that you know what to avoid, the essential question becomes, what should you actively do to strengthen your brain and protect your memory? Because avoiding damage is only half the work. You also need to build cognitive resilience. That's exactly what I cover in the video appearing on your screen right now, where I go through the most well-supported supplements and strategies for long-term brain health and cognitive protection. Did this video give you something valuable? Show it, like it, and share it with someone who needs to hear this. Protecting the memory of the people we love is one of the most meaningful things we can do. I'm Dr. Marcus Bennett, and this has been evidence-based health content grounded in clinical experience. Subscribe to the channel for more information that can make a real difference for you and your family. Until next time, protect your brain, protect your future.